to approach respiratory diseases. First and foremost, history and clinical examination, which remains the paramount step in diagnosis of respiratory diseases. History like history of cough, its duration associated with hemoptysis, weight loss, fever, etc. Clinical examination, not only respiratory system, the general physical examination along with the lymph nodal status is also gives some information regarding the type of respiratory diseases we are dealing with. The first line of investigation is imaging modalities like chest X-ray, CT, HRCT, PET-CT, etc. These imaging modalities will help us to understand, are we dealing with a diffuse parenchymal disease or focal disease. If it is a focal disease, whether it is neoplastic or non-neoplastic. If it is neoplastic, it will also help us to understand whether it is a local disease, locally advanced or metastatic disease. Next line of examination is direct visualization of airways. This is through bronchoscopic examination with or without endobronchial ultrasound. So during this, we can also localize the lesion to look to understand the nature of the lesion and also its feasibility for interventional procedures. Moving on to the last step is interventional procedures for tissue diagnosis, which remains the gold standard. So these interventional procedures may be either CT guided or fluoroscopic guided or by bronchoscopic procedures, where we can get the samples both for cytological and for histopathological examination. Moving on, what are different types of lung biopsy? Lung biopsy can be performed by two methods. One is minimally invasive procedures, the other one is invasive procedure. Minimally invasive procedures include needle lung biopsy. Here, this is done either with CT or fluoroscopic guided through percutaneous or transthoracic approach. Whereas transbronchial or endobronchial biopsy, this is done by using bronchoscopy with or without endobronchial ultrasound. Then we have cryobiopsy. This is again a bronchoscopic procedure, and these cryobiopsies are usually performed to diagnose interstitial lung disease. So the main advantage of cryobiopsy is that the tissue artifact is negligible. Then the last one in minimally invasive procedure is transthoracic biopsy, which is called as video-assisted transthoracic surgery and the biopsy. Then open lung biopsy, which is an invasive procedure, and it is rarely performed nowadays, and it is indicated when all the minimally invasive procedures are failed to obtain a representative sample for diagnosis.